Okay.
Good afternoon. My name is Mayhew, and I am the Commissioner for the Maine Department of Health and Human Services. It probably comes as no surprise that I am here today to discuss with you the future of Maine's Medicaid program, Maine Care, and why our state cannot afford to expand this taxpayer-funded health care program to an additional 100,000 people at a cost of more than $800 million over the next 10 years. The indisputable fact is that Medicare has grown by more than $1 billion over the last 10 years. It has doubled in size, both in terms of the number of individuals enrolled and its cost. That growth has come directly at the expense of other significant priorities, both within the Department of Health and Human Services, as well as other critical investments in other state agencies in support of industries and programs and individuals that matter for the future of this state and our economy. You will be hearing from some of my colleagues today about how that consumption of state funds by Medicaid has limited, or in many cases sacrificed, their ability to do important, meaningful work that would benefit the people of Maine. But first, I would like to talk about some of the real needs that are not being met within the Department of Health and Human Services. As we debate adding 100,000 able-bodied adults to Medicaid, many of whom, and this is critically important, many of whom are today eligible for subsidies in the exchange, an exchange that will pay providers at commercial health insurance reimbursement rates. If you ask a provider, do you want an individual who is reimbursed by Medicaid or through commercial health insurance, they more often than not will say, we need commercially insured patients. Today, as we look at these competing priorities, we have thousands of elderly and disabled who are on wait lists for critical services. Today, we are not fulfilling their needs. We are not meeting our mission as a department to support our most vulnerable in this state. And while many will say that our adults with intellectual and developmental disabilities have access to Medicaid healthcare services, I am offended that we are ignoring the fact that when we deinstitutionalize, when we make needed decisions to close institutions like Pineland, we must at the same time make the commitment to support them in their communities with the kinds of support, staffing supports in their homes, rehabilitation programs, work support. Let's be clear who we're talking about. It's an 80-year-old mother caring for her 50-year-old son with Down syndrome. She is scared about her own ability to meet his needs, and worse, where is he going to go when she's no longer around? We are talking about real families with children with autism and developmental disabilities who are about to graduate from high school, and the parents are panicked. We get those calls because their child is about to go on an adult waiting list. They've been part of an educational system where many of their services have been met, and as an adult, we don't have the funds to provide them with the same array of services. Many of these children cannot be home alone. Those services, that wait list today, the cost of funding those wait lists is over $45 million in state dollars needed annually to cover the costs of those individuals, our elderly, our disabled, our most vulnerable, who also need to look to this state and have their needs effectively met. I also want to point out that as part of those wait lists, we are talking about our elderly. As we chase federal dollars, we forget, we neglect other valuable programs that may not leverage federal funds, that may not be eligible for federal Medicaid reimbursement, and yet they are critically important. For our elderly, we are all dealing with an aging parent, grandparent, aunt, uncle. And we know that to keep them in their homes, some of the first supports they need is meal preparation, house cleaning, laundry, services, basic services. We have a program, it's called Homemaker. It's 100% funded with state funds. It's not eligible for federal Medicaid reimbursement. There are more than 1,000 people right now on that wait list, which is probably grossly understated, because once you get to that point, it's futile to continue to add people to that wait list. And yet that is such a critical program. And when we think about the rapidly aging demographic in our state, it's clear we have got to be prioritizing those services and our ability to effectively meet the needs of our rapidly aging demographic. Let me also mention other services within the department that are simply not and have not received the kind of prioritization as we've been bailing out the boat of a Medicaid program that has been rocked for more than a decade, year after year after year, with a financial crisis. While you are struggling to address that crisis and pouring more money into that program, we are taking away from other needed priorities within the Department of Health and Human Services. In children and family services, we have reduced some programs for families with low risk of abuse. Important prevention and early intervention services for these at-risk families that would reduce their need for higher intensity services by the department. We need more child protective caseworkers, but again, have been up against the challenges of other competing resource priorities. Rate reductions in mental health and substance abuse services have watered down programs and services as providers are unable to continue to staff at the same levels and offer the same range of services. We all know that nursing facilities in this state are financially vulnerable. We've had nursing facilities in rural parts of the state that have closed. So as we look comprehensively at the Medicaid program, we also need to acknowledge the deficits that exist today in our ability to adequately pay providers to ensure that they are financially stable and actually able to, again, meet the needs of our existing Maine Care members. Democrats have said that adding 100,000 people to Medicaid is somehow free, but we all know better. Again, we've done expansion in Maine. We know the realities of it. This program, as I said, as a result of previous expansions, grew by over $1 billion and doubled in size, and we didn't pay our bills. We just resolved more than $750 million in debt to Maine's hospitals directly as a result of unfunded Medicaid expansions. It is nonsensical to believe that after years of financial crisis in Medicaid that the answer today is to add another 100,000 people to this program. Don't be fooled by efforts to combine expansion with a fancy legislative proposal to manage care in Medicaid. The miraculous savings being advertised are not real and are thinly veiled efforts to get support for a massive expansion of Medicaid. We do not live in a world of unlimited resources. If the state expands Medicaid, our elderly and disabled will wait longer for services. That is a price we cannot afford to pay. Efforts to contain spending in the Medicaid program should be focused on meeting the needs of our most vulnerable and addressing other critical needs in state government that my colleagues will present today. Government simply cannot be all things to all people, and we must put the needs of our most vulnerable citizens at the front of the line and ensure that state government is effectively prioritizing our limited resources in the best interest of the future of this state. At this time, I would like to turn the program over to the Department of Marine Resources Commissioner, Patrick Heller.